Have you ever thought about what might be silently cutting your life short without you even realizing it? Most people don't. They go about their daily routines, unaware that certain invisible dangers are creeping closer every single day. The shocking truth? By the time many people realize they're at risk, it's already too late. Their bodies have weakened, their choices have vanished, and they're left wondering if they could have done something differently. The reality is 5 deadly threats are lurking beyond age 75, waiting for the right moment to strike. These are not just random accidents or unavoidable illnesses. They are silent killers that claim countless lives every year. Some are obvious, but others may completely blindside you. What's worse, many people could have prevented them if only they had known what to watch for. Today, we're going to uncover the 5 leading causes of death after 75th, the ones responsible for nearly all fatalities in this age group. Some of this might seem obvious, while others may surprise you, but one thing is certain: knowing them is the first step toward preventing them. These aren't just statistics. They represent real lives, real families, and real choices that could mean the difference between struggling with health problems or living a long, fulfilling life. Stay tuned until the end, because these 5 causes are not undeniable. In fact, by making small but meaningful changes, many people have significantly reduced their risks, stayed independent longer, and added years, sometimes decades, to their lives. The decisions you make today could determine how strong, active, and independent you remain in the years ahead. Now let's get started. Number 1. Heart disease. Heart disease is the leading cause of death among people over the age of 75, yet many fail to realize that most risk factors for this condition can be controlled. The heart is a tireless organ, constantly working to keep the body alive. However, like any other muscle, the heart can weaken over time if not properly cared for. The concerning reality is that the early warning signs of heart disease are often subtle or ignored until the condition becomes severe. This is why many older adults only become aware of heart problems after being hospitalized for a heart attack or stroke. One of the biggest contributors to heart disease is high blood pressure. Over time, high blood pressure puts immense strain on the walls of the arteries, forcing the heart to work harder to pump blood throughout the body. The dangerous part about high blood pressure is that it often presents no clear symptoms. Many people are unaware they have high blood pressure until a serious event, such as a heart attack or stroke, occurs. This makes regular blood pressure checks essential. A healthy blood pressure level should be maintained at below 120/80 mmHg. If high blood pressure is detected, lifestyle changes and prescribed medications can effectively help control the condition. Poor diet is another major factor leading to heart disease. Many older adults have a habit of consuming processed foods that are high in salt, sugar, and saturated fats. Over time, these habits lead to plaque buildup in the arteries, causing atherosclerosis, a leading factor behind heart attacks. Reducing salt, sugar, and unhealthy fats, while increasing the intake of nutrient-rich foods such as leafy greens, fruits, whole grains, and healthy fats like salmon and avocados, can significantly improve heart health. Lack of physical activity also contributes to increased heart disease risk. When the body is inactive, the heart does not get the exercise it needs to stay strong and efficient in pumping blood. Additionally, inactivity slows down circulation, increases the risk of blood clots, and raises pressure on the cardiovascular system. Older adults do not need to engage in high-intensity workouts to maintain heart health. Even light exercises like walking, cycling, yoga, or stretching can help strengthen the heart, improve circulation, and lower blood pressure. Stress and prolonged anxiety are also significant risk factors for heart disease. When the body is stressed, the nervous system activates the fight or flight response, causing the heart rate to increase, blood pressure to rise, and cortisol levels in the blood to spike. Over time, this state of heightened stress can damage blood vessels and weaken heart function. Techniques such as meditation, deep breathing, listening to calming music, or participating in social activities can help reduce stress and have a positive impact on heart health. Finally, many older adults accept heart disease as an inevitable part of aging, but this is not necessarily true. Studies have shown that lifestyle changes can reduce the risk of heart disease even in later life. Eating a balanced diet, maintaining a healthy weight, exercising regularly, managing stress, and keeping blood pressure under control are key factors in maintaining a strong and healthy heart. By making small but consistent changes, older adults can strengthen their hearts, extend their lifespan, and enjoy a healthier, more active life. Heart disease is not unavoidable. Managing it begins with daily habits. Number 2, falls and injuries. Falls and injuries are among the leading causes of health decline and death in older adults. As people age, their physical strength, balance, and coordination naturally decrease, making them more vulnerable to falls. According to health experts, about 1 in 3 adults over the age of 65 experiences a fall each year, and the risk increases significantly after the age of 75. Falls can cause severe physical injuries, including fractures, head trauma, and spinal damage, which can lead to long-term disability or even death. More importantly, the fear of falling again often causes older adults to limit their activities, leading to reduced mobility, muscle weakness, and further risk of falling. One of the main causes of falls in the elderly is weakened muscles and poor balance. Over time, the muscles in the legs and core lose strength, which reduces stability and makes it harder to maintain balance. Additionally, conditions like arthritis, osteoporosis, and joint stiffness increase the likelihood of losing balance and falling. Simple exercises such as walking, tai chi, and yoga can help strengthen muscles, improve flexibility, and enhance balance, reducing the risk of falls. Vision and hearing loss also play a major role in increasing the risk of falls. Poor vision makes it difficult to see obstacles or uneven surfaces, while impaired hearing reduces the ability to detect environmental hazards, such as approaching traffic or a slippery floor. Regular eye and hearing tests are essential to identify and address these issues. Wearing proper prescription glasses and hearing aids can significantly improve an older adult's awareness of their surroundings and help prevent falls. Home environment hazards are another major cause of falls. Cluttered spaces, loose rugs, poor lighting, and uneven floors create dangerous conditions for older adults. Installing handrails in bathrooms, securing rugs, improving lighting, and keeping walkways clear can make a significant difference. Non-slip mats and grab bars in the shower, as well as ensuring that stairs are well lit and have handrails on both sides, are practical measures that enhance safety at home. Medical conditions such as low blood pressure, heart disease, and diabetes can also increase the risk of falling. Dizziness caused by sudden drops in blood pressure or medication side effects can make an elderly person lose balance. Regular checkups and medication reviews by a healthcare provider can help identify and manage these risks. The psychological impact of falls is also significant. After experiencing a fall, many older adults develop a fear of falling again, which leads to reduced activity and isolation. This creates a cycle of physical weakness, poor balance, and increased fall risk. Encouraging older adults to stay active, participate in social activities, and build confidence in their physical abilities is crucial in breaking this cycle. In conclusion, falls and injuries among older adults are not only a physical threat, but also a psychological challenge. Proactive measures such as exercise, improving home safety, and managing medical conditions can greatly reduce the risk of falls. By addressing these issues, older adults can maintain their independence, improve their quality of life, and reduce the likelihood of serious injury. Number 3, respiratory diseases. Respiratory diseases are one of the most common and serious health challenges faced by older adults. As the body ages, the lungs and respiratory muscles naturally weaken, making it more difficult to breathe deeply and effectively. This reduced lung capacity increases the vulnerability of elderly individuals to respiratory infections and chronic lung diseases. Common respiratory conditions among older adults include chronic obstructive pulmonary disease, COPD, pneumonia, asthma, and chronic bronchitis. These conditions can significantly impair the quality of life and lead to complications, hospitalization, or even death if not properly managed. One of the leading respiratory issues in older adults is chronic obstructive pulmonary disease, COPD, which includes chronic bronchitis and emphysema. COPD is typically caused by long-term exposure to harmful substances such as cigarette smoke, air pollution, and chemical fumes. Over time, the airways become inflamed and damaged, leading to shortness of breath, chronic coughing, and difficulty in clearing mucus from the lungs. Smoking cessation, pulmonary rehabilitation, and medications such as bronchodilators and corticosteroids can help manage COPD symptoms and improve lung function. Pneumonia is another common and potentially life-threatening respiratory infection among older adults. The immune system weakens with age, making it harder for the body to fight off infections. Pneumonia can cause inflammation in the air sacs of the lungs, leading to difficulty breathing, fever, chest pain, and fatigue. Vaccination against pneumococcal bacteria and influenza is a crucial preventive measure for reducing the risk of pneumonia in older adults. Early detection and treatment with antibiotics and supportive care can help prevent severe complications. Asthma can also become more problematic in older adults due to increased sensitivity of the airways and weakened lung function. Environmental triggers such as dust, pollen, and pet dander can cause airway inflammation, leading to wheezing, chest tightness, and difficulty breathing. Inhalers, anti-inflammatory medications, and avoiding known triggers can help control asthma symptoms and improve overall respiratory health. In addition to chronic conditions, age-related changes in lung function make it harder for older adults to recover from respiratory infections such as influenza and COVID-19. Respiratory muscles weaken and the lungs lose elasticity, reducing their ability to expand and contract effectively. This makes it easier for infections to settle in the lungs and harder for the body to clear them. Regular exercise, breathing exercises, and maintaining good hygiene practices are essential for strengthening lung function and reducing the risk of respiratory infections. Poor indoor air quality can further aggravate respiratory issues. Dust, mold, tobacco smoke, and poor ventilation can increase airway inflammation and breathing difficulties. Ensuring proper air circulation, using air purifiers, and avoiding exposure to smoke and other pollutants can help improve respiratory health. In conclusion, respiratory diseases pose a significant threat to the health and well-being of older adults. Early detection, proper management, and preventive measures such as vaccination, smoking cessation, and maintaining a clean living environment are key to reducing the impact of respiratory diseases. Supporting older adults with comprehensive respiratory care can help them maintain better lung health, improve their overall quality of life, and prevent serious complications. Number 4, stroke. Stroke is one of the most serious and life-threatening health issues faced by older adults. It occurs when the blood supply to the brain is interrupted or reduced, depriving brain tissue of oxygen and nutrients. Within minutes, brain cells begin to die, leading to potentially severe and permanent damage. Stroke is a leading cause of disability and death among the elderly, making early recognition and immediate medical intervention critical to improving outcomes and reducing complications. There are two main types of stroke: ischemic stroke and hemorrhagic stroke. Ischemic stroke is the most common type, accounting for about 87% of all strokes. It occurs when a blood clot or other obstruction blocks blood flow to the brain. Risk factors for ischemic stroke include high blood pressure, high cholesterol, diabetes, smoking, and heart disease. Hemorrhagic stroke, on the other hand, happens when a blood vessel in the brain ruptures, causing bleeding, hemorrhage in or around the brain. This type of stroke is often linked to high blood pressure, aneurysms, or trauma. A key warning sign of stroke is a transient ischemic attack, TIA, also known as a mini-stroke. A TIA occurs when blood flow to the brain is temporarily blocked, causing stroke-like symptoms that resolve within a few minutes or hours. TIAs are serious warning signs of a major stroke and should never be ignored. Common symptoms of a stroke or TIA include sudden numbness or weakness in the face, arm, or leg, especially on one side of the body, confusion, difficulty speaking or understanding speech, trouble seeing in one or both eyes, dizziness, and loss of balance or coordination. Immediate treatment is crucial for minimizing brain damage and improving recovery chances. For ischemic strokes, clot-busting medications such as tissue plasminogen activator, TPA, can be administered to dissolve the clot if given within a few hours of symptom onset. For hemorrhagic strokes, surgical intervention may be necessary to stop the bleeding and relieve pressure on the brain. Preventing stroke in older adults requires managing risk factors such as high blood pressure, high cholesterol, diabetes, and heart disease. Lifestyle changes like maintaining a healthy diet, Engaging in regular physical activity, quitting smoking, and managing stress are essential for reducing stroke risk. Regular medical checkups and monitoring of blood pressure and cholesterol levels are also important for early detection and prevention. Recovery after a stroke can be challenging, especially for older adults. Physical therapy, occupational therapy, and speech therapy play a critical role in regaining lost functions and improving quality of life. Emotional and psychological support is equally important, as stroke survivors often experience depression and anxiety during the recovery process. In conclusion, stroke is a severe health risk for older adults that requires immediate attention and ongoing management. Early recognition of warning signs, prompt medical care, and effective rehabilitation are key to improving survival rates and quality of life. Educating older adults and their caregivers about stroke prevention and management can significantly reduce the impact of this life-threatening condition. Number 5. Cognitive decline. Cognitive decline is a major health concern among the elderly, significantly affecting their quality of life and overall well-being. As people age, it is natural for certain cognitive functions, such as memory, attention, and processing speed, to decline gradually. However, when cognitive decline becomes more severe and interferes with daily activities, it may signal more serious underlying conditions, such as mild cognitive impairment, MCI, or dementia. Cognitive decline not only affects the individual's ability to think and remember, but also impacts their emotional health and social interactions, making early detection and appropriate care essential. Mild cognitive impairment, MCI, is often considered the transitional stage between normal aging and more serious cognitive disorders like Alzheimer's disease. Individuals with MCI may experience noticeable memory loss, difficulty concentrating, trouble finding words, and increased confusion. However, they are usually able to carry out daily tasks independently. While not everyone with MCI will develop dementia, the risk is significantly higher. Dementia, on the other hand, refers to a group of symptoms affecting memory, thinking, and social abilities severely enough to interfere with daily functioning. Alzheimer's disease is the most common form of dementia, accounting for 60% to 80% of cases. Other types of dementia include vascular dementia, Lewy body dementia, and frontotemporal dementia. Early signs of cognitive decline may include forgetfulness, misplacing items frequently, difficulty following conversations, poor decision-making, and changes in mood or personality. As the condition progresses, individuals may struggle with recognizing familiar people or places, lose the ability to perform basic tasks, and experience significant confusion. Emotional symptoms such as anxiety, depression, and social withdrawal are also common, as individuals become increasingly aware of their cognitive decline. The causes of cognitive decline are complex and multifactorial. Aging itself contributes to the shrinking of certain brain regions, reduced blood flow to the brain, and decreased levels of neurotransmitters. Other risk factors include high blood pressure, diabetes, heart disease, smoking, poor diet, lack of physical activity, and social isolation. Genetics also play a role, particularly in diseases like Alzheimer's. Preventing or slowing cognitive decline requires a comprehensive approach. Regular physical exercise improves blood flow to the brain and supports the growth of new brain cells. A healthy diet, rich in fruits, vegetables, whole grains, and omega-3 fatty acids, supports brain health. Mental stimulation through reading, puzzles, learning new skills, and social engagement helps keep the brain active. Managing chronic health conditions such as hypertension and diabetes is also crucial for maintaining cognitive health. Treatment options for cognitive decline depend on the underlying cause. While there is no cure for Alzheimer's and most other forms of dementia, medications like cholinesterase inhibitors, e.g. donepezil, and NMDA receptor antagonists, e.g. memantine, can help manage symptoms and slow progression. Cognitive therapy, memory exercises, and a structured daily routine can help individuals cope with cognitive challenges and maintain independence for as long as possible. Supporting individuals with cognitive decline requires a compassionate and patient approach. Caregivers and family members should create a safe and structured environment, provide emotional support, and encourage social interaction to reduce feelings of isolation and anxiety. Respite care and support groups can also provide relief for caregivers and improve the quality of care. In conclusion, cognitive decline is a significant health challenge for the elderly, affecting not only memory and thinking, but also emotional and social well-being. Early detection, lifestyle modifications, and appropriate medical care can help manage symptoms and improve the overall quality of life. Educating both the elderly and their caregivers about cognitive health is essential for promoting independence and dignity in aging. An important lesson for elderly individuals is to take proactive care of both physical and mental health. As the body begins to weaken, it is essential to listen to changes in the body and seek timely medical support. In particular, maintaining light exercise habits such as walking, yoga, or breathing exercises not only improves blood circulation but also strengthens heart and respiratory health. Moreover, keeping a relaxed mind and maintaining social connections helps elderly individuals feel happier and less lonely. Spending time with friends, talking with children and grandchildren, or joining senior clubs are effective ways to nourish the soul. More importantly, listening to your body and accepting the natural process of aging is the key to living peacefully and fully. Cherish every moment, maintain a healthy lifestyle, and find joy in life's simple pleasures. Thank you for joining us today. We'd love to hear from you. Leave a comment below and share one thing you learned today and how you plan to house it in your life. Your thoughts are important to us, so don't hesitate to share them. Reading your comments gives us great motivation and encouragement. If you enjoyed this video and found it helpful, please like, subscribe Elderly Stories channel, and share. Your support helps us continue creating good content to inform and inspire you. Thanks for watching, and we look forward to seeing you in the next video.